My goal really is to have them, the residents, be able to operate and feel like they can do just about anything. But I don't want to just have them be clinically sound. We also want them to be future educators and future academic surgeons. One of the things I think we do really well at this program is provide that autonomy. So by the time the residents are finally graduating, they know how to do just about anything.
Residents are integral in the care of patients here at the University of North Carolina. They are the frontline workers in the inpatient and outpatient settings. And it's really a wonderful educational experience, but also a service experience for the residents. They care for patients. They're the ones who, round, set orders with the backup of attendings. They are the key players in the care of patients here in the hospital.
So I was really looking for a program that married kind of high volume, broad-based general surgery with an academic center. And really there's very few programs that do that in the country as well as we do it here. We get a lot of operative experience, a lot of trauma experience, and then we also get a lot of, niched specialties. You can really go to any fellowship from here. The faculty are really supportive and trying to get you where you want to go, but you also get the experience to walk straight out into practice.
Having a hands-on experience is what works best for me, and we get a lot of great technical feedback from our attendings in the operating room consistently on a weekly basis, both through our residency program as well as divisional meetings for more targeted education for what we're rotating through.
We are looking for people who want to be leaders in those areas, that are willing to put in some time and effort to become really good in whatever domain they choose to pursue. That's really what we hope to foster through the 5 years of surgical residency and surgical clinical training. Learning how to take care of people better, more efficiently, and with improved outcomes, and providing an environment to train the next generation of surgeons and physicians. Research is an important part of that. That in many ways is the learning how to do things better. But paying attention to how we do that in the context of taking care of patients and educating people. Obviously lots of overlap between those three missions.
The greatest benefit of UNC is the other residents. The people that I hang out with when I'm not working are the same people I hang out with when I am working. You become a family. You have a level of trust that you've gone through this together, that both while you're working, you trust each other to get the job done and help each other. And when you're not working and you need to confide in each other about things that are going on outside of work, you have somebody that you trust, you can talk to. We would always meet at a resident's house, and they'd invite all these applicants and strangers into their house. That really shows kind of the community that we're in.
Well, we spend the majority of our time at the main UNC campus in Chapel Hill. We also rotate at a smaller UNC hospital in Hillsborough. That gives us a sense of what community general surgery is like. And then when we're out in Raleigh, we're at WakeMed. We have a really high volume trauma center. And so it gives us exposure to some different options in terms of what sort of setting we want to practice in after. And we're not just all at the academic center all the time.
We're not trying to make every person the same in this residency training program. We're trying to offer them a broad menu of opportunities so that they can feel where that passion arises and then follow it. It's not meant to be one size fits all here in our program.
Every step of the way I've felt incredibly challenged, but never given anything that I can't handle. And every step of the way, there's different things that I need from my senior residents or my attendings, and it, for whatever reason, always feels like those things are handed to me, the right challenges, the right amount of help, the right support.
During college, I was interested in the sciences and in biology and anatomy, and kind of combining those two and having an older sister that was an anesthesiologist, looking up to her, I found that if I didn't make it playing basketball, that I could be a pretty good physician. In basketball, we would often shoot 500 shots a day just to shoot one in a game, or shoot 5 to 10 shots in a game, and translate that over to the surgery realm where you're learning skills and tying knots and throwing sutures and learning how to work the different machines. You have to spend time practicing, and you have to spend more time practicing when the game's not on, and then when the game's in, things directly translate.
So what makes this program unique is that there's a lot of flexibility in how you approach your training. So some places have a mandatory 2 years of research. Some places you can't go out for research unless you really kind of get a lot of support from your department. Here, it's very much if you have a plan and there's something you want to do, the department will support you to take professional development time out. UNC from the start was very much like, well, if there's an idea you want to pursue, let's think about how we can facilitate that instead of saying, well, here's your preset options, pick one of these 3 or don't go out to research. That's a very unique thing.
Really, every faculty member gives us the independence and the support to learn how to operate. It's a tough field and it's a tough residency. You need to be pushed to be able to get through it, but you need to be mentored and supported too. UNC does a good job of that. We're busy here, but we're also very supported. They give us the freedom to sort of learn on our own, to push ourselves, to find what interests us and pursue that. And so I think that balance is really important. It can be difficult to find it sometimes, but I think UNC does a good job of that.
This is a wonderful place to raise a family. It's a place to have public education that's at the highest level. At the end of their training, many of them are saying, how can I stay in this area? It's just a wonderful place. People recognize that they can fit into this community no matter their background very easily. It's just an academic, enlightened place to live.